I think it's so crucial that female patients have the ability and the desire to ask questions about their care, to not just be like, well, whatever you think, you're the one with the degree. They're the ones with their lived experience. They're the ones who are going to be living out the consequences or the outcomes of those decisions. So just knowing that they can ask questions is really crucial. Some of the planning that goes into that, like with doulas, we do prenatally, like a lot of birth planning, and it's not a one size fits all birth plan. Everybody's gonna have things that are really important to them and things that are not super important to them.
Our team works to help empower women by seeing value in their bodies rather than just their appearance. We do this through a lens of health. We validate challenges that may come up during the weight loss journey and help to provide our patients with tools and resources to support them.
When I think about our team, I think about the navigators, the dietitians, the social workers, the art therapist, our integrative medicine nurse practitioner. Part of the power of that role that they collectively exert is their ability to meet people where they're at and to help them find their voice, to serve as their voice if they're unable to do so for themselves.
Recently, one of the patients reached out to me who was having a recurrence of their gastric cancer. They were very overwhelmed and concerned about the results of this test. And just through talking and connecting them with our social worker, they were also able to find relief and comfort in this process.
One of our doulas who lives in Gresham and was working out in our Mount Hood service area was working with a patient who was experiencing food scarcity. And she came to us and said, what can we do for this patient? And Legacy has a food bag program. So we got the doula connected with the food bag program. The doula was able to secure some food for the patient, actually helped support the patient with recipes and cooking so that she could cook and provide nutrition for her family and herself in the prenatal period. And then postpartum, the doula was able to provide that opportunity again, where she made sure she went out, did a postpartum visit, made sure she had food, made sure she was cooking nutritious meals for herself and her family. Her family was provided for. Made sure, she's getting the sleep that she needs, making sure that breastfeeding is going well. All of those things and that touch point of care can provide the opportunity to reduce the risk of postpartum depression.